the oncology team is very focused on curing the cancer and making the patient better. But more needs to be done to, down the road, because survival rates are improving. Down the road, these patients may come up with other problems as a result of those cancer treatments. And I think that's important to get that message out there.
Welcome to All Things Cardio-Oncology. This is the podcast of the International Cardio-Oncology Society. My name is Steve Caselli, and on this program, most of the time we spend our time speaking with physicians, and today we have a special opportunity to hear from a different perspective the cardio-oncology experience, and that's the perspective of a cancer survivor. So it's my pleasure to welcome Dennis Keefe to our program today. Dennis lives in Edmonton, Alberta, Canada, and he has agreed to share his story with us. So welcome, Dennis.
Well, thank you, Stephen. I'm happy to be here. Thank you for your invitation.
Yeah, we're delighted that you're willing to spend this time with us sharing a little bit about your personal experience. And maybe we can sort of pick up the beginning of the story. I take it you grew up in Canada, and you're a young person, healthy as far as you know, pursuing university studies and a career. And tell us when things began to change for you.
Well, I was living and working in Vancouver, British Columbia, on the west coast of Canada, and I was pursuing a career in aviation at the time. And I was a bit of a long story. I hope you'll endure this, but I had a few symptoms, and a lot of the early testing was inconclusive. In July of 1990, I woke in the middle of the night with a sudden onset of significant pain in my right ribs.
And Dennis, I'm sorry to interrupt. Did you tell us at what age did this begin?
Oh, I was 27 years old at the time.
Okay.
Yeah.
Great.
And I was an invincible young 27-year-old.
Yes.
So I believed, yeah.
Of course.
And I just woke up in the middle of the night with this real significant pain in my ribs, and we did a little research in hospital, and nothing sinister was found, and the pain eventually went away at that time. And then a few months later, I had moved on to a new air charter company up in northern Alberta. And I started coughing. And I had a deep, heavy cough, but I had no other flu or cold symptoms. And that cough would bother me. It would be in the right rear flank, and it hurt. In April of 1991, I was feeling rather poorly, and I had a chest x-ray. And again, nothing sinister was found. And it was quite unusual, because this cough was really it was significant, I believe, at the time.
And of course, this is pre-COVID, so you're not alarmed by a cough other than perhaps a flu or a cold symptom.
Well, I guess I was concerned. I was alarmed in some respect, because it was just this heavy, deep cough that I couldn't seem to shake, and nothing really would solve it. But there again, I was a 27-year-old guy thinking, I'm invincible and I'm otherwise healthy.
Mm-hmm.
So I was discounting it, really. Yeah. Excuse me. In about May of 1991, so about a month later, I was heading back to Northern Ontario to take on a new position out east. And my family was living in Edmonton at the time. And I stopped in to visit with them and have my medical validation certificate renewed for my commercial pilot's license. And I had no symptoms other than the occasional deep cough and right rib pain. And part of the process of maintaining a commercial license is similar in the US, where we have to have a medical validation certificate signed by a civil aviation examiner. And I went to see my aviation examiner for the revalidation of my medical certificate. And he asked how I was doing. And again, 27-year-old guy, I felt pretty darn good. I was going back to work and pretty happy guy, chasing a flying career. And I said, yeah, it hurts a little bit when I cough. And he said, where? I said, well, the right flank. And he performed an examination, and he said, okay, well, let's have an x-ray. This Dr. Ian Scott, sent me across the street for an x-ray. And literally, he slid it up into the screen, and we saw a mass in my right rib cage. Yeah. And we had a good discussion about it, but he believed it was pleural fluid, but wanted more investigation prior to signing off on my medical validation. And of course, without that medical validation, my commercial pilot's license was no longer valid, and I could not work. Yeah. So he referred me back to my family physician, who ordered a CT, and this is where things get, I guess, a little more interesting, if they weren't already. During the CT, a double needle biopsy was performed, and they drew very little blood and no pleural fluid. And it was described as a pleural-based density found in my right lung base. So I returned to Dr. Scott and asked if he would sign my medical validation. I was anxious to get back to work. I had a job waiting for me.
Sure.
And I advised him of those biopsy results, and he wasn't satisfied. I asked him what it would take to get my medical validation back, because I had to go to work. And he said surgery. Right. And I believe at that very moment, Dr. Ian Scott, my civil aviation medical examiner, he saved my life. And I can't overstate that.
Yeah.
He was the guy that insisted that further investigation was needed.
So he was clearly suspicious.
Yes, yeah, he was very suspicious. And if I was not a pilot who needed a medical validation, and I had simply ignored my symptoms, I believe my outlook would have been far different than what it was.
That's remarkable.
Yes, yeah. So in July of 1991, it seems so long ago, I was sent to surgery with really no expectation that it was anything other than pleural fluid. Again, I was this young 27-year-old guy, pretty healthy. I felt I was pretty healthy. And literally the word cancer never, ever entered my mind. Dr. Nakai, who was a thoracic surgeon, and his team, they performed a right posterior thoracotomy where they found a grapefruit-sized mass in my right rib cage. And so they resected my 8th and 9th ribs, the intercostal muscles, and performed a biopsy of a lesion on my diaphragm. And the pathology of the mass and ribs found malignant small cell tumor that was involving bone and soft tissue. I think they made the assumption there that it was a Ewing sarcoma, and it was later verified by pathology. And I literally, Steve and I had no idea it was cancer until I was visited post-op by my family physician, Dr. Ken Gardner. Literally put his hand on my shoulder and said it was cancer.
Oh my goodness. So here you are, a young, healthy young man at the, front end of a seemingly hopeful career in aviation, and suddenly you hear those words that we all would be terrified by. It's cancer. Do you remember how that hit you, hearing that diagnosis initially?
Yeah, I'm sure I had the typical reaction that any patient would have when receiving a diagnosis like that. It was really devastating. It was absolutely unexpected.
Yeah.
I had gone into the surgery believing they were removing pleural fluid. I was quite anxious to go back flying, and after the diagnosis, those immediate feelings of fear and sadness, it was immense.
Yeah.
A few weeks ago, I was chatting with my sisters, who told me something I had never known until quite recently. After my surgery in 1991, my family physician had pulled my family aside and told them the cancer had been found and the prognosis was poor. He referred to a 15% chance of beating the disease, and at that time, I don't recall that prognosis. I don't recall that devastating, percentage. All I heard was I had cancer, and that's the only thing I heard. So many things kind of blur out at that moment.
Yeah, I'm sure. That's unimaginable.
Yeah.
Well, where did things go from there in terms of what testing did they do? What was the treatment path from there? And I know that you've been able to piece some of that back together in your own research, but where did they go from there?
Well, after discharge from the hospital, I was referred to the Cross Cancer Clinic here in Edmonton, a fabulous facility that looks after patients in northern Alberta. I met my oncologist, Dr. Jurgen Jensen. He assured me they would treat me aggressively, and he was optimistic, but offered a conservative 20 to 30% 5-year survival rate. Again, that's something I just recently learned from my sister. So there were so many difficult parts of this journey, but that diagnosis was pretty awful.
Yeah. And can you give us some more details on what the treatment path was from there, just in terms of the specific drugs and regimen of therapy that you were put through at that point?
Right. Yeah. So Dr. Jensen's plan was to treat it aggressively, and I was admitted as an inpatient for each chemotherapy treatment. And the plan protocol was 5 days in the hospital, out for about 17, back in for 2 days, and then out for 12. And I received high dose etoposide, ifosfamide, over 5 consecutive days, and then over a kind of a one overnight visit, I would get cyclophosphamide, adriamycin, and vincristine, and over that one day. And over the course of the entire treatment, I received 17 courses of chemotherapy and then some radiotherapy as well.
Well, that's probably not atypical for some cancer therapies, but that's certainly really intense therapy that you had to undergo. And how long did that go on, did you say?
It was about 14 months of chemotherapy.
Okay.
And then I had about 6 weeks off, and then they started 5 weeks of daily radiotherapy.
Right.
Where I received 5,000 grays over 25 treatments in 5 weeks.
Goodness. Yeah. So this is very aggressive cancer treatment. Can you describe, from that point, how did your recovery go after the treatment?
Well, it was tough. I had a lot of neutropenic fever episodes requiring numerous hospital admissions. On one occasion, I actually felt quite well, and Dr. Jensen gave me his approval for me to travel, and I left Edmonton and went back out to Vancouver to visit my sister, who was living there at the time. And the next morning I wake up and I've got a fever, and I had to go spend 11 days at the British Columbia Cancer Agency in Vancouver. But they were, at that time, there was a new drug coming out, and I think it's quite common now, I believe, GM-CSF. It's the granulocyte macrophage colony stimulating factor. And to me, the drug was quite new, or to my doctors, the drug was quite new. And my health plan at the time wouldn't cover the cost. So I had used all my savings to pay for that drug. And up here in Canada, we're very, very fortunate in that we have public health care, publicly funded health care, but there are limitations. At that time, this drug was not covered. But the results were fantastic. It helped my body fight off those infections by accelerating the growth of my white blood cells. And after starting the GM-CSF, my recovery after chemotherapy treatments was much easier.
And so you finish up your chemo treatments. You then go in your course of radiotherapy.
Yeah, October 1992. I think it was Halloween. In fact, the nurses in the inpatient ward at the Cross Cancer Clinic, some of them were dressed up. I remember that. But it was my last. They gave me a great send off, and it was my last chemotherapy treatment in October 1992. And I started my radiotherapy in February of 1993, and had a 5-week course of treatments.
Okay. And then maybe we can fast forward from there. You did recover, which is remarkable, and you were able, in one sense, to move on with your life and to pursue a career, and you got married along the way, had children. Is that right?
Yeah, I put the I tried to put the cancer behind me, but I think it's impossible. There's always an element of fear of recurrence that stayed with me, and although that fear and those memories have over time have diminished, but I was exceptionally lucky. The cancer was found early, and my girlfriend at the time, Tracy, was incredibly devoted and caring and loving, and she would sleep in a cot beside my bed, and she would step in to help when the nurses were busy. And I can't overstate her care during those times. But I somehow she agreed to marry me, so we got married in 1994, and lucky enough to have 4 wonderful children. And I wanted to go back flying. But when I was ready to go back, and I thankfully got my license reinstated, in Canada there was no jobs in the early 90s. It was pretty bad for pilots. So I moved on to a new career, and I've been there for 28 years.
That's amazing.
Mm-hmm.
And then tell us what happened 3 years ago now. When did you begin to have some symptoms that were once again concerning, symptoms now of a different kind?
Yeah, in about 2017, I started having trouble sleeping. I had brief episodes where I felt short of breath, and I was increasingly fatigued. And my family physician referred me to my current cardiologist, Dr. Suhaib Al-Cortez, for his initial examination. And I had a few cardiac tests, the ECG, the stress echocardiogram. I had a nuclear perfusion scan. And after those tests, I was diagnosed with dilated cardiomyopathy. And about a year ago, also diagnosed with atrial fibrillation.
So now on top of the cancer, you suddenly find yourself with heart disease unexpectedly.
Yeah, I was, a young, I guess at that time, 51, 52 years old. I was back playing baseball and feeling pretty good, and then my condition started to diminish from there. And the cardiologist has found these issues.
So how did you then put these two pieces together? You've put cancer behind you 30 years ago, and now all of a sudden you have heart trouble. how did you figure out there might be a connection between those two realities?
Well, there's no significant heart disease in my family, and I was curious. Of course, Dr. Internet offers many research opportunities, and
Yeah.
I was curious. I wanted to know more about my condition and what this is. And I came across some articles that suggested late onset of heart disease was the result of chemotherapeutic agent cardiotoxicities. And I was wondering if I was experiencing that same late effect 3 decades after chemotherapy. So
Hmm.
I requested my patient records from the Cross Cancer Clinic, and through some treatment and discharge summaries, I was able to determine that some of those chemotherapeutic agents that I received during one of the aggressive cancer treatments may have contributed to possible heart damage.
Hmm. Now, were you ever informed at the time of your cancer therapy that some of the agents you were being given had this potential cardiovascular side effect, or did anyone ever encourage you to see a cardiologist as part of your follow-up screening after your cancer therapy?
Well, I remember being advised that they were watching my heart function a few months into the treatments.
Okay,
Um,
so during your treatment.
right, and during the chemotherapy treatments, I had a MUGA scan that had reported my ejection fraction had dropped, something like 40%.
Hmm.
Um, and I had a follow-up heart study during the time that did report some ejection fraction improvement, but I never met with a cardiologist, and I was
Mm.
never referred to a cardiologist following chemotherapy and radiotherapy. And I, in fact, never saw a cardiologist until I started having symptoms in 2017. And yeah, that was a little concerning to me.
Yeah. Well, unfortunately, I think that's, not altogether uncommon, which is why we're here having this conversation. Is there's still, even to this day, I think a lack of sufficient awareness across disciplines that these side effects are realities that need to be addressed. There's obviously, we're doing much better today than in the past, but for people who went through therapies as you did 20, 30 years ago, those cardiovascular impacts are just showing up today. Well, what what would you want to be sort of a take-home message for other survivors from your experience?
Well, I guess, a few messages. A new cancer patient, I think, should lean on every resource at their disposal, including accepting offers of help from family and friends that may offer that, cancer patient greater personal strength and hope. It's really important to have, people behind you.
Yeah,
In my case, my family and friends were wonderful, and their efforts um, helped me just immeasurably. So, and it helps them too. It helps
yeah,
them feel like they're part of the treatment process, and it kind of reduce their own anguish and feeling of
mm,
helplessness.
yeah,
But I think new cancer patients should also have access to an oncology team that includes a cardiologist.
right.
Um, I think cancer survivors should ask for a referral to a cardiologist to get their baseline studies of their heart functions, and then follow up with routine appointments to monitor their hearts. And it really should start. It should start when the chemotherapy starts and follow right through.
Yeah, and thankfully, as the discipline of cardio-oncology has developed, there is much more opportunity for both, pre-screening and post-screening of cardiovascular issues for cancer survivors and cancer patients. So, I'm so grateful for your willingness, Dennis, to share your story with us and your experience. And it's a perfect illustration of why cardio-oncology is continuing to grow so rapidly as a discipline. Cancer patients and survivors of all types are increasingly aware of the hard reality that those life-saving treatments that they're receiving and so desperately need often have potentially serious side effects. But the good news is when, as you're saying, there's a team involved that includes cardiology and oncology, many of those risks can be mitigated. So thank you for taking the time today, Dennis, to share with us your experience. It's a perfect illustration of why this discipline is so valuable and so important.
It's truly my pleasure. Thank you for inviting me.
Our annual Global Cardio-Oncology Summit, the GCOS meeting, will be a virtual meeting this year due to the global pandemic. It'll be held on Thursday, October 1st. For information, you can go to our website, ic-os.org, and on our homepage, you'll find a link for the conference registration information. We hope you'll be able to join us.